I know what universal health care is, and generally speaking, I believe it to be government-sponsored or government-directed health care.
It is a program where those who do not have insurance can go through a process, can apply to have government-provided insurance, or individuals who are young and healthy who choose and don't have a form of insurance can make a selection and purchase a product, or people who will no longer have health insurance because of the Universal Care Act will have to go on universal insurance, which is
So by negotiating via one plan, that means that you can bring down general healthcare costs, which is the biggest issue with the American healthcare system currently. Everything costs too much money. See John Green for more details. I think that the most controversial thing is definitely the small business person's issues, because it could end up either costing people a lot of money. Hopefully, if everything works out properly, they can maybe ask their employees to go on that. I don't know what the number is cut off, so that part is my weak point, but I do sympathize with small business people. However, I think that people have to remember that healthcare is part of your salary, and that if a business is going to start, they need to think about that before they start.
It's not that I think, it's that I know through conversation, many people who have small businesses now, one, are very concerned about the financial investment that Affordable Care Act.
I think that having a single payer system, such as like the UK does, can be very effective, because it can help negotiate prices to bring down the cost of healthcare, which is what the biggest problem here is in the States. But if you do that and compromise and if you don't go all out, it may not work.
Have a great day. Should be a means by which people who have pre-existing conditions, have financial difficulties, should there be some path for them to have or to acquire health care? Yes, I do. And having worked in the healthcare industry before I became a teacher, I believe that if we all handled our own money, we all handled our own healthcare accounts, we all handled our own retirement funds, we all handled our own money and expenses, we would actually know what things cost, and we would be much better consumers, and we would make better choices, and we would raise up a nation of people who understood personal accountability.
I am not sure I'm allowed to answer that question, but yeah, I do.
Okay.
It's ideal, so long as everything is put into place and it works. I mean, I think that a team is only as strong as its weakest member, and I think that if healthy and sick all buy into a program, it can help to control costs and just be better for the whole country. Being sick is terrible, and you shouldn't have to stress out about paying for treatments.
Government that inspires the individual maybe provides opportunity. I mean, the first role and main role of government is protection of its people. After that, it provides a way for people to get to and from work. Roads, traverse, that type of work. But a government could and should encourage good education. These things should be handled on the state level, not a massive size. And this way, states would do what was right for the individual state. There needs to be standards. I understand that. We need, especially, I know that working in education and healthcare, we need good standards to promote good health. But we don't need widespread care where there's very little oversight possible, because it's just so. Well, they're one and the same, and I do not support them in the format that they have been put before the public.
You're not going to get me on that one. Okay.